So they took registered nurses with expertise and recruited them to collaborate with these primary care physicians. In 1965, there was development of Medicare and Medicaid programs, which is health insurance. In 1965, two physicians, Dr. Loretta Ford and Henry Silver, created the very first training program for nurse practitioners. This was started care to patients. There is formal education that's required beyond general nursing. At the minimum, a master's degree entry level. Majority of programs these days have a doctorate, so a doctorate of nursing practice or a PhD. And of course, being able to explain and apply theory, ethical, legal, caregiving, which is all part of our nursing profession. We also have to maintain certain core competencies currently for the nurse practitioner certification. About every 5 years, we have to take these, complete these competencies. And of course, our profession is influenced by changes globally, socially, politically, and economically. There's something called an advanced practice registered nurse consensus model. So this was created to have these various advanced practice roles specialized in a certain population. Now, majority of advanced practice nurses in the United States are nurse practitioners. The second most is nurse anesthetists. The third, nurse midwives, and the fourth, clinical nurse specialists. What is the education preparation for becoming a nurse practitioner? So you have to start with a bachelor's degree. This is minimum of 4 years, followed by taking the National Council Licensure Exam, the NCLEX. Once you pass that, majority of programs require you to have at least 1 to 2 years minimum of experience as a registered nurse. And then you enroll in a graduate program. So either entry level is a master's degree, where it's a doctorate, DNP, nursing practice degree. Once you complete additional 2 years or 4 years, depending on master's versus doctorate, you take the exam. Is a very similar track. However, for the nursing background, they require at least 1 to 2 years of experience in the intensive care unit. Likewise, for nurse midwifery, very similar track, but while you're gaining your experience as a registered nurse, you can do additional certifications like neonatal intensive care nursing certification. And again, a very similar track for clinical nurse specialists. Now, what exactly do each of these roles do? So certified registered nurse anesthetists mainly work in preoperative, intraoperative, and postoperative management of patients, pain management, and advanced airway management. Certified nurse midwives Many of them work in rural areas, so they are actually serving as primary care providers. A lot of health promotion, disease prevention, gynecological, sexual and reproductive services, and of course, pregnancy-related care. So prenatal care, delivery, and postpartum care. And clinical nurse specialists, they are expert clinicians, educators, research, and consultants. Nature of practice for nurse practitioners. We are licensed independent practitioners. We practiced autonomously and in coordination with other healthcare professionals, so physicians, respiratory therapists, physical therapists, social workers. Our role includes diagnosis and management of both acute and chronic conditions. So we do ordering, performing, supervising, interpreting both diagnostic, laboratory tests, making the initial diagnosis, as well as treating patients, including both pharmacological and non-pharmacological treatments. A huge part of the role of all advanced practice nurses is health promotion and disease prevention. So coordinating care, counseling, educating both patients and their families. Of course, research. We're consultants for the interdisciplinary team. And core of nursing is being patient advocates. Now there's something called scope of practice for advanced practice nurses, specifically nurse practitioners. What you see in green is a full practice authority where the state that you live in allows you to independently diagnose, order tests, treat patients without requiring a supervising physician. Reduced practice has some limitations with this, and restricted practice, in order to practice as a provider, as a nurse practitioner, you require a supervising physician. Now, where exactly do nurse practitioners work? So they, of course, work in the primary care setting. I have trained both as a family nurse practitioner as well as an acute care nurse practitioner. And some of the roles that an acute care nurse practitioner can do is in subspecialties. So cardiology, electrophysiology, critical care medicine, pulmonary, trauma surgery, nephrology, gastroenterology, and emergency medicine. So why become an advanced practice nurse? Well, there are prosperous job outlets. There's more areas for specialization. So if you didn't want to do primary care, of course, you can go into one of those above mentioned specialties. And there is further independence of practice. So as mentioned in 2 slides before, although some states have restricted practice, you are still considered an independent provider, meaning you have your own license. You have a supervising physician who is your resource person, but you are still an independent provider. Of course, enhanced leadership opportunities, competitive pay. These days, there is a huge growth of telehealth, especially during the pandemic. And of course, more flexibility in your hours. And that is the end of my talk. Thank you.
Thank you, ma'am, for this wonderful talk. Actually, you sailed us through your journey from beginning till date. So it was actually excellent, and we came to know so many aspects which we actually, in being in India, do not know about the nurse practitioner. So you talked about the different roles of nurse practitioner, as you said, independent consultant, patient advocate, and other things. So as an individual, which particular role you enjoy doing as?
Great question. Thank you. I love all those roles. And I think that's the best part about being an advanced practice nurse. You are the go-to person when the patients have questions, being the patient advocate, education with the patients and their families. I work in a hospital setting and the physicians are more procedural focused. So the nurse practitioner is the main go-to person for the consultants, for the primary team. Yeah, so to answer your question, being able to do all those roles makes it even better.
Okay, that's great, ma'am. And ma'am, you talked about some restricted areas where practice is restricted. So what are the what are the criteria on which basis they have restricted the practice?
Good question again. It is more political. So those states have very conservative members in the legislative, and they feel that nurse practitioners really need a supervising physician in order to practice. So yeah, it's more of a political than education training.
Fine. Okay, ma'am. So, how would you suggest the other countries like India to promote the advanced this nurse practitioner course to run smoothly? What all can be done at the management level, at the political level, or at our local bodies level to promote this course here?
I think what you have now in terms of the Society of Cardiac Nurses is a huge step into this. You need really all nurses to be, or nurses that want this advancement to be on the same page. So there's a lot of variation here in the US between, in terms of salary, in terms of, restriction of scope of practice, and we really need to stand together, number one. Number two, we need to convince our local national leaders as to why this role is very important. So one of the reasons for the advanced practice role, the nurse role emerging here in the US is because of the shortage of both in primary care and now in specialties to represent on both a state and a national level.
We wish to have such eminent leaders as the nursing is going far away now in India as well. So we are taking up many roles. So very soon, we really wish under the guidance of all of you, we will also be able to, practice advanced nursing practice there. So we have some questions in chat box for you, ma'am. So Ms.
Sure.
Shanti Ida, she asked what about independent midwifery? So is this also part of the this nurse practice only, advanced nurse practice?
Yeah, so out of all the different roles of advanced practice nurses, nurse midwives probably have the most autonomy in terms of practice, and especially in rural areas of the country. So there's, lack of access to an OBGYN, and nurse midwives play a huge role in that.
Okay. So there is another question by Amika Rani. She asked, can a nurse practitioner midwife advise medication, perform antenatal and postnatal checkups?
Yes, all of the above.
Okay, ma'am. And what is her role in cesarean section? Like she'll be acting as a helping hand?
Yes.
Okay, ma'am. Okay. So that was our eminent speaker, Ms. Dipti Verghese. Thank you so much, ma'am. We are privileged to have you on this forum. I would like to ask any of the panelists to unmute their, this open is forum.
Yeah. Yes, Parul. I would like to ask actually, Dr. Dipti, it's a very wonderful presentation. We are looking to hear from you about your being a practitioner, cardiac nurse practitioner, or EP practitioner. What is your role and responsibility in US? How will you make differences than other, other practitioners? Can you just express to us something little about?
Oh, sure. Thank you so much. So cardiology has always been my passion ever since I was a new nurse. And found my niche in cardiac electrophysiology. So in my role, I do both inpatient and outpatient. So I see patients in the clinic, new consultations, follow-ups. Focus is on atrial fibrillation now. So we are in the process of creating an atrial fibrillation clinic. In the inpatient setting, I do consults, admit patients, do a lot of the pre-procedure and post-procedure care. So whether it's education, the orders, and a unique part of electrophysiology is the operative or procedural part. So I have trained with the cardiac electrophysiologists that I work with to do, to basically first assist. So getting access, both femoral and venous access, doing right ventricular temporary pacing, and the electrophysiology study prior to the cardiac ablation. So all unique roles that are specific to cardiac electrophysiology. The good thing about this is that I get to do a lot of cardiology also, and you have to do a lot of reading, attending conferences, keeping up with that continuing education, because cardiology, as you all know, is a very evolving specialty. And so keeping up with all the changes in the guidelines is very important. So having a good foundation in cardiology will help you advance even more in subspecialties, whether it's heart failure, electrophysiology, interventional cardiology, or these days we have a newer specialty called structural heart.
Thank you, Dipti. Actually, it's a very good, that come to know that. Actually, one more thing, it's interesting to get it from you that how you made the difference during COVID, especially the remote monitoring is one of the most important. To, patient not able to come to institutional. That's why we are all happy to know that we come out with the advance in India, even government of India, to realize that nurses to be utilized at the independent level to manage many extent. So can you express to us, and during COVID, being a nurse practitioner, cardiac nurse practitioner, and EP practitioner, how you monitor, how you made really more good enough to be the, to the healthcare system in US?
Oh yeah, good question. So especially during COVID, we were still very busy. There were our baseline set of patients who had their, arrhythmia problems or cardiomyopathies or heart failure problems. But COVID also induced a lot of these problems, increase in whether it's tachyarrhythmias, heart failure. So in the beginning of the pandemic, we did do telehealth visits. So it was a video chat. Patient would take their vital signs, their blood pressure monitoring at home. If they had devices, they would do a remote transmission of that. And we would get it on our end and discuss our findings. But honestly, maybe a few months into the pandemic, patients actually preferred coming into clinic to have their face-to-face visit with the provider. And one of the big ways we use our remote monitoring is for a prevention of hospitalizations or reduction of hospitalization. So if we know patient is in the early stages of developing decompensated heart failure, we ask them to take an extra dose of a diuretic. If they're going having more recurrences of, say, atrial fibrillation, certain arrhythmias, we would ask them to take an extra dose of their current medication or give them a new medication. Whatever ways we can try to reduce their hospital visit.
Thank you, Dipti. We are looking forward from you and many more in future. We are having some physical conference at AIM soon, international conference. We'll hope to meet you. Thank you very much. Over to Parul.
Thank you, sir. And thank you, ma'am, for this eye-opening talk. and we really wish to listen more and more from you in our upcoming conferences. Thank you, ma'am. So now moving forward, I would request Dr. Anu Gaba, who is a professor at College of Nursing at Amity College of Nursing, Gurgaon, to take over and further proceed with this session. Ma'am is also an active member of Nursing Teacher Association. Kindly proceed, ma'am.
Thank you so much,
Sorry,
Parul.
sorry to interfere you, ma'am. So, this is Neeraj. I have one more doubt, one more query from Dr. Deepti. As you know, like in India, we do the pulmonary vein ablation here. Okay, so we do the cardio procedure here. So in that, like as a nurse practitioner of electrophysiologist, you are over there. So what is your role in case of the, especially in as a pulmonary vein ablation, and you do the cardio procedures and etc.
Okay. So in an AFib ablation, I would, or I have in the past done access. So in the electrophysiology, this is just a procedural part of the management of that rhythm problem. I get access. So after the patient receives anesthesia, I get both arterial and femoral access, obtain, put the catheters up and do temporary RV pacing. And the HIS catheter is typically put in by the cardiac electrophysiologist, but he's right next to me. And then also participate in the electrophysiology study. The actual ablation portion is done by the physician. And we use both radiofrequency and cryoablation, depending on the type of atrial fibrillation, whether it's in its paroxysmal stages versus more persistent. So that's my role in the lab.
Okay. So you people also help in the interpretation of the route from where the arrhythmias occurred.
Oh, so we actually use a mapping system, and
yeah, I'm talking about that.
Yeah. So we have technicians. So some of them are engineers from the mapping company who assist with that. So there's they kind of sit in the control room of the lab and kind of guide us as to where the activity is coming from.
Okay. Thank you so much.
Thank
Dr.
you.
Deepti.
Thank you so much.
Very good evening to one and all present here. So this is Dr. Anu Gaba. So now we are going to start our next session. We have Dr. Sudha Reddy ma'am with us. Ma'am has completed her graduation from AFMC Pune 1992. She has completed her post-graduation from KLE Institute of Nursing Sciences in OBG Nursing, MPhil from Manipal University 2006, and doctorate degree from INC in 2014. She has participated as a SOMI leader in exposure visit to Sweden 2009. Ma'am has a part of many UGC, NAC, and INC peer team visits for evaluation of universities. She is a master trainer for virtual capacity building program for midwifery faculty organized by INC and UNPFA, and also master trainer for helping babies breathe program. She has a principal investigator for funded project on mental health for postpartum mothers with Thomas Jefferson University, USA. She has organized many international and national conferences and workshops. She has total 27 international and 17 national publications in her credit. Ma'am manages dual role at hospital and nursing college. Ma'am is advocacy committee member in Association of Nurse Executives India. Welcome, ma'am. Welcome to the webinar. Over to you, ma'am.
Thank you, Dr. Anu. I'll just share my screen, and a very good evening to all of you, the nursing professionals across India and Deepti. I'm really privileged to be in such a platform, because when Dr. Farooq called me up and he said, "Ma'am, you have to speak something," I said, I practiced cardiac nursing when I was a student and nursing officer in the army, but now I'm an administrator. No, ma'am, some experience you share with us. So I hope I'll do justice to him. And Neeraj sir, I'm so impressed by the way so passionately you introduce the Cardiac Nurses Society of India. Like इससे लगता है कि आप कितने passionately have been working on it with your group. Like Parul is with you, Danny is there, and Mayamma, and all others were your office bearers who are here today representing your society. And look at it, your interdisciplinary collaboration with the other people, even a publisher who is, many of us are publishing books. So they have given a platform for us to meet. And of course, the Nursing Teachers Association of India. And I really would like to work with both of you, all of you, because we were doing our calendar of events for the coming year. And we were thinking like what kind of national level conferences and workshops we need to take department. I was planning on a conference on artificial intelligence in nursing, but then at state level, at least I would like to collaborate with all of you and get members from my place also. Be in touch with me, Neeraj sir. And of course, I'll be in touch with you. After all this, Dr. Gopi Chandran from AIMS, most of you from AIMS, I'm seeing the office bearers, and do convey my regards to Lata ma'am. And we are very happy about this advanced nurse practitioners, this topic which we discussed today, and paving the way in India, of course. And Deepti, we are so proud of you. You're one of the many nurses from India who are doing good abroad. Half of my FMC batchmates are nurse practitioners, nurse anesthetists in US, in different parts. And we do share conversations and know the challenges which we are facing, which America faced from 1940 onwards. With this little acknowledgement to each and every one of you who are attending today's webinar series, I would like to start with it. I hope I do justice to the topic with whatever material I have collected and I would discuss with all of you. And, I start with this picture. I bring a lot of meetings to you from KL University. And if you look at this picture, this shows Dr. Sadhanava, who is the elderly person in the middle, and along with him, the person in tie is my medical director and chief executive. Sir is the governing body member of the hospital. He himself is a doctor. Then it's me there. And I have so many nurse practitioner students. Of course, the tall person tie behind is Dr. Rajesh Pawar, Vice Principal of the Medical College. We met in the MD's room, and some of them are passed. 2 of them have passed out. One is a final year student, and the remaining are the first year students. So we get a lot of support from them. I think we as nursing professionals fail to gain their notice and, to come up because of the lot of issues. It may be politics, it may be we not being confident enough to pursue the matters at higher policy levels. So they are always supportive. And I think we need to become stronger if we dream of having a nurse practitioner, like how they have American Academy of Nurse Practitioners. If we dream of having an Indian Academy of Nurse Practitioners in years to come. Like a little bit of introduction, I just went through some journals and I was reading through what is this advanced practice nursing. Matlab, we are going to talk about it, but what exactly is it? It refers to the enhanced and expanded healthcare services and interventions provided by nurses only, provided by nurses who in an advanced capacity influence clinical healthcare outcomes and provide direct healthcare services to individual families and communities. It is a definition taken from CNA and Hamrick and Tracy's definition from 2019. And again, the picture down are my pictures of my nurse practitioners inserting, extubating, helping in intubation. So that's why I have thought that to really show that in every part of India where NP is happening, things are happening. It's not that it's not happening. The best example is the beautiful, amazing series of webinars, which with ECO, the Ministry of Health and Family Welfare had, Rati Balachandran and Anuradhika, and the whole team of master experts from around India. I mean, it was an amazing 10 weeks program. And you could see the nurse practitioners doing case presentations, presenting. And I was thinking, my God, are these our nurses? Where are they? I mean, everyone should know the visibility of them, what's happening. There's a slow revolution happening in India, actually. And then what I learned, glancing through some literature, was like we have an advanced practice nurse who is the one who has acquired through additional education the expert knowledge base, complex decision making skills, and clinical competencies for expanded nursing practice, the characteristics of which are shaped by the context in which they are credentialized to practice in different specialities, like how Deepti was mentioning some of them. This is ICN definition of in 2008, who say what is an advanced practice nurse and what does she do. Whereas the clinical nurse specialist and nurse practitioners are two types of advanced practice nurses, most frequently identified internationally. So it should be very clear that we have advanced practice nurses, and there are two types: the clinical nurse specialist and the nurse practitioners are the two types of APNs, which I was like, when glancing through the literature, I was trying to understand, oh, so they are the CNPs and the NPs who form the APNs. And then if you look at these pillars of advanced nurse practitioners, they have this clinical management and leadership skills, education and research. And when you look at our NP syllabus, which is beautifully crafted by INC, and it includes all these competence. And then the standards and practice of skills, the advanced level of practice and creation, and the employer assurance of the competency, the professional build up upon the reputation of the nursing profession, and the public confidence and assurance in the continuing care is what is the challenging thing which the advanced nurse practitioners are doing. And so who are the advanced practice nurses and what do? They provide safe and competent patient care. They have their foundations in nursing education. They have roles or levels of practice which require formal education. Nobody can become a nurse practitioner without any kind of formal education beyond the preparation of the generalist nurse, like where we have minimum entry level as a BSc nurse for our this, and masters for the doctorate in nursing practice program. So always adopting a basic standard is safe for the competent nursing. So with this little bit of basics, then I'll move forward to discuss what's happening in India. But when you look at the advanced practice nurses, they also have roles or levels which of practice with increased level of competencies, which we have seen in our NPs, and capability that are measurable beyond that of a generalistic nurse. And we all agree that NPs in India, whoever are there in the colleges across India, have succeeded in doing much more than what a generalist nurse is doing in the ICU. And they have acquired the ability to explain and apply the theoretical, empirical, ethical, legal, caregiving, and professional development, which is required for advanced practice nursing. Of course, when we think of ethical and legal, we know what limitations has been given by each hospital for the nurse practitioners to practice. And these APNs, their competences and standards, which are periodically reviewed for maintaining currency in practice, are influenced by the global social, political, economic, and technological milieu, which we have not yet really started thinking in India, because we have just started, I think, the 4th or 5th batches on the run now in India. And but then it really proves that the advanced practice nurses, like if you look at some research study which I got through, which was conducted in Australia, it found that nurses in the field of advanced practice nursing exhibit patterns of practice that are different from the other nurses. According to Gardner et al. In their study, they had done a study in 2016 where they worked on this, identifying advanced practice, a national survey of a whole nursing workforce, and they found out कि नहीं, जो ये nursing advanced practice nurses हैं, they do exhibit different patterns of practice above our nurses. And using an advanced practice role delineation tool based on the strong model of advanced practice findings, it demonstrated the capacity to clearly delineate and define the advanced practice, again in 2017 when they did the study. So these people are required, the advanced practice nurses are required to support specialized and super specialized healthcare services, specialist nurses, and they will be able to meet the demand. We are still not able to come in terms because some of us feel ki kuch ho hi nahi raha hai and please do not have a career path. We'll come to it in the end of the presentation in the last few slides. But then because why we are positive, why I am positive as a nursing professional is because in the new national education policy, if you go through, there's a mention of nurse practitioners. They have a national common NEET and exit exam and other things. And in that they have the mention of nurse practitioners, the new education policy. And we know what is happening with the independent nurse midwifery practitioners. In 2018, the government guidelines have been released by the Prime Minister Modi, and in the conference, the 2018 guidelines are there. If you go to the Ministry of Health and Family Welfare website and click, this huge amount of work which is done to get midwifery visible in India. That there were 6 NMTI set up, National Midwifery Training Centers, then every state level, which is called as SMTIs, State Midwifery Training Centers have been set up. If you go through that, there's a lot of scope even for the private universities and colleges to get a center for them at state level to start the midwifery training. And it's a different, if you talk about independent nurse midwifery practice, it has a different pathway and a different session, since it is of Cardiac Nursing Society and NTI. So I thought I will focus on NPs here related to the one program which we are running in India in the critical care residency, postgraduate residency program. And thus the rigorous educational preparation which we are giving them will enable them to diagnose and treat patients with critical illness as well as preventive and promotive care. And it all depends on the hospital, the intensivist under whose preceptorship these nurse practitioners are working, because I don't see my NPs in the college at all. I always see them in the clinicals, and it is really 80% clinical and hardly 20% of their theory classes are taken at the college level. And it is one of the first postgraduate programs, I think, in any specialty across India where competency-based education has come up. We started with BSc recently, but the nurse practitioners have this in India. And there are a lot of models, like this is one 360-degree approach to patient adherence, like where we know that we have predictive behaviors, predicting the behaviors and personalizing the interventions and scaling up adaptability. If you really know what it is and customize it to the Indian system, like if you look at the predicting behaviors, it means developing comprehensive view of patient with real world data, conducting modeling to identify key drivers of non-adherence and apply predictive analytics. So here, when they mention this, it doesn't mean only the nurse practitioners who are working in the critical care setting here, but also the family care practitioners. And then when you look at the personalizing interventions, means refining targets, focusing on high priority segments and personalized interventions designed for patient specific drivers of non-adherence. This is basically a model which is focusing on the strategies to be learned and employed in independent nurse practitioners in the community, which we had started in India, but it didn't roll down. And the third point is scaling up the adaptability, where you test and learn, and you also develop cross-functional capabilities to deliver a comprehensive engagement strategies. So this is a rigorous training for the advanced practice nurses, which should come in our educational program. Now, I just want to again come back to the basics of what is happening with NPCC in India. Just taking an example, it started in 2017 in India. We never had any students in the first year, 10 seats, nobody came, because it's still not so popular in South India. And the institution, we enrolled in the NPCC program, and we are one of the 8 in the state of Karnataka. So imagine, in spite of having 30 seats, we just have 6 seats, which shows it's still not well taken by the students. They don't know where they will be placed after they take it. Still, in spite of all those challenges, to motivate people and make them join in a place where no other colleges except Manipal here, now we run NPs. This year, many have applied. Again, this is a picture of our own students. So just for all of you, that NP, we all know it's a postgraduate nursing residency program. We have competency-based training, 2 years. And we should always remember these 3 things, that जो competency based program है NPs का, it has core courses, advanced practice courses and clinical courses besides clinical practicum, which is a major component. So we have core courses, advanced practice courses and clinical courses which comprises of this, and it's a major approach. And this education is based on competencies which are adopted from the International Council of Nurses and the NONPF, which is the National Organization of Nurse Practitioner Faculties in US. So NONPF competencies of 2012. And an attempt has been made by INC to propose this curricular structure towards preparation of NPs at master's level. And the special feature of this program, many of us know, but for all of you, it's a clinical residency program where there's a strong clinical component with 20% theory and 80% of skill lab and clinical experience. So we really need to have a simulation lab and clinical experience where they can really learn in lab and also go there. So we all know this is the most popular framework which has been given for nurse practitioners in India. And if you look at what I was telling you, core courses, advanced practice courses and specialty courses and strong clinical components. So this is one educational curriculum framework which summarizes the whole basis of the NP program, which is proper. And why we wanted to do this in India was because we know the nurse-patient ratio is less, 1:7 per 1,000. And then we know recently the WHO has told that we need around 4.4 million nurses by 2040. From where are we going to produce them? And meanwhile, the NEP has come up, which is supporting the NPs, and it mentions everywhere the nurse practitioners. So definitely government has it in its mind and career pathways will come up for it. And what I feel is the irony here is that the midwifery program is all by government, set up in government colleges, and more importance was given to government colleges, public sector in opening this, because some of the private players like us, we tried our best to get them to our facilities, but we didn't get. Whereas this nurse practitioner in critical care residency program is more in the private sector because we have more of ICUs and training. But what is happening? There is no career pathway clearly set up for them here. Whereas in the government, in public sector, when you look at the independent nurse midwifery practitioner program, they have a clear requirement of more than 87,000 midwives in the subcenters and PHCs. And those who will come out of that have a clear-cut career pathway for them in the public health system. उन्होंने बताया कि how many NPs will be there in the subcenters, in PHCs, in district hospitals, and also in the medical college hospitals in the labor room. It is clearly specified. Whereas this program, like it depends upon every private player who can either lift them up or exploit them to use their skills. So, but coming back to why this course was has been brought up in India, and what are the cost-effective, competent, safe, and quality-driven specialized nursing care which they can give in a variety of settings in tertiary care centers are like performing ABC in an emergency situation, alerting physician and intensivists when a condition worsens, knowledge of interaction of therapeutics. Let me tell you कि उनका pharmacology इतने detail में, all of our medical teachers take pharmacology classes for them intensively. They attend the journal club with the postgraduate students of the medical college when they do this. So they have been trained in such a way. I told them, don't feel low, don't feel you're less than them. You're my first batch, second batch. Whatever you will carry forward, the juniors will come up in that way. So a lot of pain, lot of counseling has happened, and doctors have really respected them and taught them well. And then they do invasive and non-invasive procedures in critical care units. I have seen them doing the invasive BP monitoring, non-invasive BP monitoring. I've seen them doing this TED stockings and insertion and care of CVP line. I've on rounds, I have seen them removing arterial lines, collecting blood samples from central lines and arterial lines. Of course, that even our critical care nurses do. And I was amazed the amount of freedom they were given by the intensivists to do these things. And care plans, prescribing medications, and the other things which the INC expects was evaluation of outcomes, recognition, management of complications and untoward reactions. They have been a kind of help for the intensivists because I may just talk about my setting. They didn't have any PGs or any courses in intensive care. So these were the only PGs for the intensivists whom they, mothered, and they were so possessive about them. They went for rounds with them. And this is a small example or vignette of how they grew confident, And if you look at this slide represents what the NP program is for and how it prepares a certain level of generalistic nurses or BSc nurses for advanced practice roles as clinical experts, managers, educators, and consultants. Like you have NPs, and you can see in clinical nurse specialists, nurse midwifery practitioners, nurse anesthetists, etc., etc. So these are the different roles which they take up. The other day, 2 days back, we had our academic council meeting, and I was getting the revised syllabus of NPCC course approved in the academic council. So I was just telling ki what are the reforms, what are the change reforms and other things. Then the vice chancellor was telling me that why you are only depending on this course, why don't you start other courses? I said, sir, ये तो चल रहा है इतने कम students के साथ, and independent nurse midwifery practitioner, we don't know where we stand until unless we get a state midwifery training center for a private college, then only we can have them. So what can we do? I mean, the what bureaucratic tapeism or whatever it is called, we are ready, but then how do we move forward for this? Because there's a different level of working in AIMS or in government hospitals, whereas in private it is different. So he says, why don't you do something else? I said, sir, I'm thinking of getting nurse anesthetist program to roll in with Thomas Jefferson University. But then, we get a program, and if it is not under INC, then people are reluctant to take it. So I'm very happy that INC is thinking about DNP, that is a doctorate in nursing practice program, which it is going to pilot test in Karad and MGM Mumbai. That is what I have learned. So we all know that when we complete the NP program, so these are the responsibilities of accountabilities, clinical competence, applying the principles of whatever they learn, theory, pathophysiology, pharmacological principles, and they are able to identify the critical conditions. They are able to collaborate with other healthcare professionals in the critical care team across the continuum of critical care. We have seen it, what has happened in COVID and how the NPs have contributed in a huge way, because we know even in some of the places, the specialists, the doctors were not even entering the ICUs. It was the PGs, the nurses, and wherever NPs were there, it were the NPs. In my place, the opposite happened, because both the intensivists who were working with my NPs, they entered the COVID wards. So they told them, no, you look after the East Wing. I mean, we have a 5th floor. We have around 270 ICU beds in our hospital, which is a 2,400 bedded hospital. So they said that, no, that floor you people manage. Anything is there, you let us know. So they were all into the COVID things, the intensivists, and these people were managing the normal patients. So they have learned to work in team. And then there are these other things which I feel it is my responsibility to tell and not just leave. What were the competencies? Like they use advanced comprehensive assessment. They are being taught very comprehensive physical assessment by the doctors, by the nursing teachers who go for rounds there. And the treatment planning, implementation, and all happens with the doctors' rounds. They are regularly, sometimes when we go to see them, they are busy with the doctors, with the rounds, doing things. So we do not disturb them. Applying and adapting advanced skills in complex and unstable environment is going to be one big challenge. And applying sound, advanced clinical reasoning and decision making. This we really need to learn in India. We learn them for giving NCLEX RN exams to go abroad, but then when we really need to practice it, critical thinking, clinical reasoning skills, reflective learning, all these are important to inform, guide, and teach in the practice. Again, drug administration and treatments as per the institutional protocols. Like in Karad, they may allow certain more procedures, but in KLE, they may allow no, NPs, you do only this much. INC has laid down a list of protocols, but it again depends upon the hospitals, how much freedom they give them. I remember Captain Usha Banerjee, who is the director of nursing for Apollo Group. She said that they have done some Angel Foundation where group of nurse leaders are enrolled and they want to train around 1.5 lakh nurses across India and give them some kind of monetary benefits. And she said, anyone who is an NP, please send them to Apollo, we will absorb them. So this kind of platform is being provided for them. And very important that they have to apply communication, counseling, advocacy, interpersonal skills. Otherwise they can, and how to discontinue the therapeutic relationship. Somewhere in the slides, I saw the name of Pepleo in 1960s. So we all know Hildegard Pepleo, how she was, and she introduced the most beautiful theory of communication, interpersonal communication. And then applying sound, advanced clinical reasoning and decision making. Finish this. And also then we have the other competencies which they need to have. Introducing tests, evaluating and managing evidence-based practice. We need so much in India because if NPs will really be empowered, then they will be the people who can man at grassroots level and provide this kind of services. And without any good clinical practice, if there's no research and we do not have any evidence-based practice to improve the safety, efficiency and effectiveness of care, then it's of no use. So that is another competency which they develop, and also engage in ethical practice in all aspects. Like there's so much of confusion. People say that after doing nurse practitioner in critical care residency program, can we practice in the clinic community? Can we open a clinic? Can we practice? But then they are nurse practitioners in a critical care setting. So they have to work there and provide care to the critically ill patients. NPs, more forms of NPs will come up, a family care practitioner program will come up in India, which when they do, they may practice in the community. And then these are some other, I may not go into so much of details about the competencies, but again, these are another 3 last competencies which I would really like to just, run through. Like you have to accept the accountability and responsibility for your own advanced professional judgment, actions, and continued competence. I remember when our students were there with the intensivist, and he just went out for a phone call or something, and the other respiratory pulmonologist came on rounds, and she was very upset. Who are these people? What are they doing? Why are they touching the CVP line? What are they trying to remove? Then he came running, and he was with them, and he supported them. Doctors also, they are not able to take care. Ye log kyun kar rahe hain? Who are they? So I had changed their uniform. I said, don't wear the nurse's uniform when you're in the NP course. Let your uniform be a little different. Put their nurse practitioner, be under the doctors. Don't do bed making only and the routine nursing care which you're giving as an ICU nurse. Otherwise, they will never, delineate your roles and they will make you do that. So it was a very tough decision to stitch a uniform for them, make them a part of the critical care department of the hospital, and always move with them. And that little bit of thing was there, my strategy to make it little different from the other students whom I have. I may be right or I may be wrong, but that was a thing which I had to do in that setting to prove to them, to show them कि कुछ अलग course है. And कुछ doctors जो US में या Saudi में रह के आए थे, they knew what it is and they took it well. And then the 11th competency which the NPs need to develop is create and maintain a safe therapeutic environment through the use of risk management strategies, quality improvement, and also assume leadership roles and management responsibilities. They have to be confident. They have to be very good with their skills because they're the first, second, third generation of NPs whom the doctors are coming across. Itne din tak kya tha? All the PhDs and MPhils and everyone was in the college. So this is the first group of people other than the GNMs and BSs. And all private hospitals across India, 80% are only GNM nurses who are manning them. So this is a slight shift, where these kind of people are coming and doctors are looking at them. Kaun hai ye log? Kya karte hain? So it's a very challenging thing for them. They are the torch bearers for all of us to develop their leadership and management responsibilities and show them, yes, whatever little scope you have given us, we are trying to do justice to it. Now comes the main slide, and I think it's the last slide where we think about the challenges. What are the challenges? Everyone knows, each one of us who are attending this, हमें पता है कि NPs what challenges they are facing. Like there are countries, that have clear career tracks or career ladders and grading. Banding होता है UK में, they have band nurses. So they have these banding systems in place for nursing role titles, descriptions, credentials, hiring practices and policies in other countries related to NPs. And these grading systems or level of roles will impact on the implementation of the advanced practice nurses. They can be CNS or they can be NPs, as the grading system will stipulate a certain level of education and years of experience, and also the roles at advanced levels. But this kind of grading system is likely to ensure that nurses working in a specific grade will perform at a more, consistent level, because they are going to be viewed to have similar education experience. So हमारे यहाँ पे for NPs to have a clear cut career pathway, grading system, how much salary to give them, all this is a very, very huge challenge. And then protecting the role titles with clear credentialing requirements will help ensure a very consistent role implementation for them. And most importantly, these guidelines will emphasize that these APNs, whether they are NPs or CPNs, are fundamentally a nursing role built on a nursing principle, but aiming to provide the optimal capacity to enhance comprehensive healthcare services. बहुत complicated sentences लगते हैं, but this is what has to happen for NPs in India. जैसे you have medical students, you have interns, you have junior residents, senior residents, then you have MDs in different stages, then you have fellowship people with advanced this. So where do the NPs stand in this, and what is the grading of the pay scales you give them as NPs, the stipend after 1 year, 2 years, 5 years? So, and we should make it very clear to our doctor fraternity and our friends that we are not in competition with other healthcare professionals. Of APN practice. We are just there to our own profession to help out in the acute shortage of nurses, because you say intensivist also for a big hospital, you have only 1 or 2. And if they train these NPs, they have a closed ICU system manned by 40-50 NPs. That is what I look at Kaylee. Like if that can happen, then that is the way we contribute to critical care as NPs and contribute our bit in quality patient care. So thank you so much. We all know Nightingale always, I love this saying of Florence Nightingale, like when you are a nurse, you know that every day you will touch a life or a life will touch yours. These are my students. See, they look so different. I tell them, ऐसे ही रहो, NP का label लगाओ, be very confident, and they look smart, and they are taken well by the doctors as nurse practitioner students. The second girl from here in specs, Jasmine, she just left for Bangalore. She's preparing for her IAS exams. Now what to do? I prepared a very good NP. She wants to do UPSC. The other girl in between, both of them are from Nepal. One has gone back, one is here only. And all these 3 boys are doing very well. Thank you so much.
Thank you, ma'am. Thank you so much. Please accept our sincere appreciation for the outstanding presentation.
Thank you. I don't think I was outstanding because I really didn't know what I should actually present, but then we wish the NPs succeed, in India. We're very, very emotional about it, because 1940 में जब US ने start किया, तो अब जाके they are so much well recognized. हम तो अभी शुरू हुए हैं.
Yes,
just we have to pray, and someone is saying pray. Yeah, we really need
yes.
to pray.
Yes, ma'am. Yeah. Yes. Ma'am, I would like to ask one thing from you. Like, do we have any nurse practitioner course in primary health care? Like I have heard like INC are going to start this program, but I didn't see any institution who have already started this. Yeah.
No. What I know was that the draft was prepared. Some of us had gone through it, and it was going to be rolled out, but it has not yet been rolled out. And only the NP in midwifery practice, that is independent nurse midwifery practitioner, and this. But then again, there is a restriction to that, because National Midwifery Training Institutes will train the master trainers for a period of 18 months. And that's a lot of, I don't know, for information for all of you, what I would like to say is that ki, सारे जो जितने भी 6 training centers हैं national level में, all of them are going to be funded by UNICEF, Bill and Melinda Gates Foundations, Japaigo, Midwifery Technical Support Unit from Ministry, and one more which I'm not getting. So they all were supposed to choose one center and fund them. Why fund them? Because foreign midwives have to come, stay for 18 months, their TADA, their accommodation, food charges, their training charges, be in the labor rooms, train them. So ये सब हुआ, but COVID के कारण क्या हुआ कि they had to rush back. And then Indian Nursing Council started the virtual capacity building workshops of midwifery tutors, which many of us, like I would take one topic in that. So ऐसे सब हुआ. Then that what happened? SMTI रुक गया क्योंकि those people who were trained only few months were remaining. And you know how sad it is that after undergoing the midwifery training, they're again working in the OT or surgery ward or medicine ward because 2 months रह गया है and they are not placed with. These are all, like as Somi, we try to get information. We feel sad, but itne challenges hai, but we have to fight. That's it.
Yes, ma'am. Yes, ma'am. And there is one question for you.
एक तो how can we become TNI member, and another is how will we get credit hours?
Ma'am, it's in chat box.
Okay,
Like after completing this NP course, where we have to register?
अभी तक तो you have to register in the state nursing council only, and all the state nursing council registrars have to be aware कि we need to have a different registry for this new pool of nurse practitioners in India state-wise, and give it to INC. So that has not started yet. Nobody has thought about it yet. And like in some state nursing council registrars have till now not registered even our MPhils and PhDs. You know, ये नहीं चाहिए बस BSc, MSc बस. So lot of awareness, and especially जो state nursing council है, they are the ones who can bring about an enormous change in the nursing care in that state. They should make efforts to create this. And I think it's a very good question. Like since I have NPs, then I will definitely write to my council to see that there is a gate open for registering them. Yes.
Okay. One more question is there. Are there any NP course in India?
Yes, we have nurse practitioner in critical care nursing. It's a postgraduate residency program. It is run in 9 colleges in Karnataka, but all over India. HIHT runs it in Uttarakhand. I think Manipal has it. We have it. Karad has it. MGM Mumbai has it, and many other places have it. And there is a WhatsApp group of all the NPs all over India, and they interact with each other, share notes with each other. It's a wonderful thing which is happening. Those of you who have missed the eco seminars by NPs have missed something very important in life in India. I feel like that you should see the pulse of the NPs there. We have NPs, yes, in midwifery and in critical care.
Thank you, ma'am. Thank you so much.
Thank
It's time for, it's time for vote of thanks. Yeah. So I express an honor and privilege to propose vote of thanks. So first of all, I thanks to Almighty God for making today's webinar successful. I would like to thanks and gratitude to our speakers, Dr. Deepti Varghese and Dr. Sudha Reddy ma'am, who took out their precious time for their busy schedule for all of us and for making this seminar a very meaningful and interesting. I convey my thanks to Dr. Gopi Chandran, patron and founder of Society of Cardiac Nurses, for his huge support at all the times. I would express my generous thanks to Dr. Farooq Khan, chairperson and president of Nurses Teachers Association of India, for their valuable presence over here. I would like to thanks to Ms. Parul for moderating the session. I also express my gratitude to all the entire executive organizing committee members of Society of Cardiac Nurses and Nurses Teachers Association of India and CBS Publishers to play their crucial role for making this third webinar series successful. I also express my thanks to all the participants for participating in the webinar series. So I would say, like, skills are the keys for success. Hard skills in nursing are the clinical competencies which are very essential to perform the task. So with these lines, I will hand over this session to Miss Pratigya. Miss Pratigya.
Yes, ma'am. Thank you so much. I am Pratigya, PR officer from CBS Publishers and Distributor. We are honored to be a part of such distinctive initiative taken by Society of Cardiac Nurses and Nursing Teachers Association for helping nurses learn more about advanced nursing practices. I would also like to thank our eminent speakers for imparting knowledge on various facets related to nursing. And at CBS, we believe in upliftment of nursing professionals through sharing quality education and knowledge and pave the way for a better future. We also believe in taking new initiatives in order to provide quality nursing education. So I'm glad to share our three major accomplishments to take nursing education to the next level, which is first is Nursing Knowledge Tree, where we have published quality nursing books authored by top-most faculties and institutes. Second is Nursing Next Live, the next level of nursing education and the first digital platform to provide quality nursing education in various forms. Third is Nursing Next Social, India's knowledge sharing networking platform to connect all the faculties to provide them with webinars, journals, and to help them to join our author, contributor, and reviewer board. And lastly, I would like to thank the SOCN and NTA members who partnered with us and made this journey more beautiful for us. We cannot end this webinar by thanking our lovely audience members who made this webinar so interactive and a huge success. So I would like to thank all.
Thank you, Pratya. Thank you, everyone.
Thank you.
Thank you,
Thank you
everyone.
so-
Thank you so much.
Thank you, Farooq and
Thank you, ma'am.
Poonam. Yeah, and nice to know new people. I think I met Neeraj here.
Thank you, madam.
And
I'm Dr.
Gopi.
Gopi.
Hi, Gopi.
Hello, madam. Nice
I've
to
heard
meet you.
about you. You must have heard about me, but I'm seeing
Yeah.
you.
When he told me that Farooq, I told immediately, madam should be there.
Thank you.
Thank you so much, ma'am. Thank you, Sudha, ma'am. Really, very respected, ma'am. Really, I called the ma'am and madam without any taking any time. Madam, given the time for our webinar. Really, ma'am. Thank you so much.
Yeah,
And thank you, Deepti, ma'am.
Thank
Dipti, I
you,
think left,
Deepti,
ma'am.
ma'am. Yeah.
Dipti is there.
Deepti,
Okay, thank
Pratigya,
you.
and Poonam. Thank you.
Thank you.
Thank you so much, Sudha ma'am, for your all-time support.
Thank you. Chalo, see you all. Bye-bye.
Thank you,
I'll be in
Neeraj,
touch with
Raini,
you.
everyone. Thank you.
Thank you everyone. Thank you, Sudha ma'am, Deepti
Yeah,
ma'am,
thank you, Nam.
and
Thank you.
all everyone from NTA and CBS. Thank you.
Thank you so much.
Special
Thank you
thanks
so
to
much,
Deepti.
everyone.
Thank you, Deepti
Thank you so
ma'am.
much. Yeah.
Nice to meet you all.
Nice meeting you all. Bye, Anu. Thank you for
Thank you,
coordinating
ma'am.
with you. Yeah.
Bye, ma'am. Take care.
Bye-bye.
Yeah.
Chalo, yeah.
Bye.